Hi, this is Dr. Mike Barnes. I'm the founder of the Michael Barnes Family Institute, and I've been wanting to do this video for quite a while. And this is a video about stories, the power of stories in family healing. And if you're aware of the Michael Barnes Family Institute, you'd be aware that we ask families to write stories. We ask them to read certain material, and then once they've read that material, then we ask them to kind of think back to I ask them a series of questions, and they write stories. And I want to be really clear that stories aren't just stories. Stories are how families see themselves and how they judge their response to their loved one's addiction and their loved one's traumas. It's the lens through which we see ourselves and see our world. And so I think it's important to begin to talk about so many of our families in the process of writing stories really struggle with the idea that they'll write it, and it's painful to write, and it's hard to remember those things that happened and what was said and the arguments and all of those things that are so important. And then they erase what they wrote because they didn't like it. And so we've been talking about it in our Wednesday support group. What is the process of writing a story? And so that's what this video is going to be about. Why do we ask people to write stories in the first place? Why is it such an important part of our program? And so I want to address those. And there's research that really supports the writing of stories, and the family members getting more clear on what their story is and what it's comprised of, and how did it happen? How did it form? So the first thing that the research tells us is that when we think about how memories are created, and particularly trauma memories, that it is often made up of kind of fractured or fragmented experiences of what was going on in that moment in time. And so writing stories and asking people to write a story and then go back and reread it and see, does that fit? Is that accurate? Is that who I am? Is that what I think? That asking them to go through that process helps them to integrate all the various fragments that were experienced during the event into a more coherent narrative. And that narrative isn't just words. It is the text of one's life or one's experience of an event that has to do with emotions and has to do with body-based feelings and people's memories of what was said and done. Stories aren't just facts. In most cases, stories aren't all that factual. But it does help us to begin to come up with a story that really represents the experience for us. The second is that it really helps us better remember or comprehend not just the event and what was said, but the totality of that. And how did we come to that memory? And how did we come to respond to that? And so reinforces new information and concepts, improves comprehension and long-term retention of the material that we ask them to read. The third thing is that it allows the individual to emotionally process the information and to let it go, or to experience that powerful emotion and then let it go. So it encourages the expression of difficult emotions and meanings, which reduces distress and supports emotional healing, particularly from the addiction and the trauma memories, the memories of what was said and done. The third is reframing or reducing shame, and that the idea of externalizing the problem, that what families get out of writing their story is the movement of the problem from a person to a realization that the problem is the addiction. And so we externalize the problem from it was my problem, it's my loved one's problem, to addiction is the problem. A chronic, progressive, potentially fatal disease is the problem. So it reduces blame, and it empowers family members to adopt new, healthier perspectives, which allows new and healthier responses. New insights create new solutions create new behaviors create new relationships, and new relationships create family healing. And that's what stories start that process. And it's writing that experience is what's part of it. The fifth thing is a shared understanding that, it allows a communication that before would have resulted in an argument to be able to say, is it possible that we all experience the same thing and have very different experiences about it? So it fosters communication, empathy, and a shared understanding of the impact that addiction and trauma has had on the family, and strengthens family bonds and collective healing. And then the last is that we find in our program that the more individuals spend time wrestling with their story, their experience, what they've, who they are and who they've become as a result of the addiction and the trauma, the more engaged they get in the healing process. The last thing is that stories allow us to measure growth and change within families. And we tend to look at 4 areas for growth that we want our families to experience. Number 1 is ability, the ability to not only learn new material, but to act on that new material in their lives. Not just in their behaviors, but in their interactional, their relational behaviors, their relational skills. The second is commitment, consistent and meaningful participation. That, do they stay in the program? Do they complete the program? Do they do the assignments? Do they read the material? Do they answer the questions? Do they write their stories? And we find that they do. The third is readiness for change, movement towards sustained behavior change. It's not just learning the material, but it's applying the material to their relationship with their loved one, their relationship with the illness, their relationship with others around them. And then the last one is trauma-informed growth. And that is not just learning about trauma, but to begin to recognize that I've been traumatized by my loved one's addiction as much as they have in many cases. And so what you see on that slide, and particularly on the right-hand side, is that for individuals who have written the stories in our program, that we found a 41% increase in their ability to use new learned material in their lives, a 29% increase in commitment to participation, to doing the work. We saw a 37% increase in readiness to change. That they didn't just learn the material, they put it into practice. And then the last one is a 48% increase in trauma-informed growth, recognizing their own trauma and beginning to act on it. And those are pretty substantial growth numbers for someone who's 5 weeks into the program. So this was from a pilot study we did with the first 70 families through the new app and the new family program. So it helps people in so many ways to sit down and wrestle with their story. Okay, why is everyone's story so unique? Well, that's a great question. And I have worked with traumatized families for years. That is where my area of research, when I was a professor at the University of Colorado, and research at Florida State when I was there. And it was the study of families who have experienced life-threatening circumstances. And it's not unusual at all for families to have significant differences in how they remember things and remembering of what was said and context. So to start it, I think it's important to say when I was at the University of Colorado Health, the hospital for the University of Colorado, and I was the clinical director at CEDAR, the Center for Dependency, Addiction, and Rehabilitation. We did a number of studies with the families who participated in our family program. And one of them was to ask family members a series of questions, and one of the questions was, is living with an actively using family member with a substance use disorder traumatizing? And in that study, 74% said that they strongly agreed that it was, 21% said they agreed that it was, and only 5% of the family members who participated said, nah, I don't think. I think I'm good. I don't think I've been impacted all that much by it. And take those numbers, and there's one mom of a 22-year-old female client who was addicted to heroin. She had an opiate use disorder. And the mom was really the first person to really share her beliefs about the fact that she was traumatized, and she did it in a really beautiful way. And she said, "It's really been overwhelming. I can sit here calmly and talk now, but that's not the same as when I don't know where my daughter is and what's happening, and I'm getting phone calls from someone on the street saying that she's been beaten and she's been raped. Really bad things are happening to her. It's not such a calm feeling when you get those phone calls, or you get phone calls in the middle of the night. I think there's a sort of post-traumatic stress disorder for families going through this." And this was her story when I asked her, "Tell me about your daughter. Tell me about what it's like to have a family member who struggles with addiction." And so we all have stories. We all have our ways of interpreting the things that happen in our lives. And so we know that there are impacts that trauma has in how we remember things, and that we tend to remember more of the sensory experiences that are happening. And so we may not all remember what was said the same, but we probably all have very similar emotions when someone's going through that, or when the family was going through that. And that it's our goal is to help them bring those similar, like, emotional responses to the story. To say, well, maybe our memory's different, but our experience has been the same. So that's one of the reasons we ask them to do that. It is also important when families say, "Well, I don't know why you're talking to me about trauma. I'm not the one that was traumatized," to talk about the diagnostic criteria for post-traumatic stress disorder, and the idea of there are 4 ways that people can be traumatized. The first is someone who experiences the direct experience of an event that involves threatened death, actual or threatened serious injury, or threat to one's physical integrity. So clearly, the person who experiences the car accident or the significant event is highly likely to be traumatized. Anyone who witnesses an event that involves death, injury, or a threat to the physical integrity of another person. Think how many things family members have witnessed and seen as the aftermath of the implications of addiction, or the aftermath of a traumatic event, and how that opens the door for family members to be as traumatized. Learning about the unexpected or violent death, serious harm, or threat of death or injury experienced by a family member or other close associate. Think of the phone calls that families get about a loved one who is in the intensive care unit, or a person who has been rushed to the hospital after a potential overdose, things like that. And so the person who experiences the event firsthand, those who witness those events, those who learn about those events, all have the same likelihood of experiencing a traumatic event. And so the fourth is something that we had put in to the DSM to deal with police officers and first responders, but it really speaks to the experience of families with active addiction. And says anyone who experiences repeated or extreme exposure to aversive details of traumatic events. And that's the experience. Those are the stories that families tell us that are the most powerful, and that are able to look at, once this illness has taken over our loved one and our family, how things have changed, and the things we have seen and experienced are important. So these are the reasons that it is important for our program to be a trauma-integrated program for family members, because the stories they tell will be altered and impacted by the trauma experienced by all of the family members. And when we ask family members, well, what are the things in your loved one's addiction that are the most traumatizing? Well, they talk about shattered dreams. That our loved one will never be who we thought they were going to be. They're not going to, they had so much potential, and now they've lost everything. And so grief and loss are a major form of trauma that families report to us associated with addiction. Dangerous, out of control behaviors, yelling, threatening, violence, assault, weapons, those kinds of things that families deal with in the course of arguing about aspects of the trauma. Legal involvement, police actions, DUIs, jail, prison, commitment, those calls that I'm in jail and I need to be bailed out, the implications of court, car accidents, other things, criminal behavior associated with it. There's all kinds of legal involvement that has the potential to be very traumatizing for families. Emergency room visits, life-threatening medical conditions, sudden unexpected crises like car accidents, those kinds of things that require family to go and bear witness to the medical struggle of a loved one. Overdose potential, actual overdose events, suicide attempts, those kinds of things. Statistically, I read a statistic recently that said 1 in 10 families in the United States have dealt with an overdose in their family or in recent years. And I think, wow, what a remarkable number of traumas that families have to deal with. A loved one's victimization, we've already talked about that, the sexual assault, physical assault, of really the vulnerability of our loved ones as they are intoxicated in the world. And then the last one is mental health issues, psychosis, depression, and other bipolar disorder, thought disorders, things like that. And so when you put all those together, we can begin to see how the stories that we have created and the stories that we remember and the emotions associated with it are going to be difficult to write. And that's what families say. I sit down to write, I put it on paper, and then I get overwhelmed and I'm not sure what to do with it. And that's why it's important for us to kind of move forward in this process. When we look at what families with a loved one and their addiction struggle with on a regular basis, if you look at that slide, you see things like intoxication. These are all the things influencing this family. Hangovers, financial problems, anxiety, agitation, frustration of family members, and conflict within the family, medical conditions, legal problems, anger and conflict. These are all things that are affecting each family member differently. That's why I love to have multiple family members in the family program, because different family members will be able to tell slightly or sometimes significantly different stories. And so if you look at that picture and you see the stress and the worry on the parents, but you also see it in the children who are maybe being impacted more by the relationship of the big people in their lives as they're adjusting and responding to this. And so again, I always asked for siblings of individuals in treatment to participate, because their stories are really very important, but also usually quite different. Then everyone would assume that all the story revolves around the person with the substance use disorder. And that's not the case. A lot of the stories that we read are about how our parents managed the addiction of a sibling, or how our parents managed the addiction of one of the adults in their lives. And so the important thing is that white box with the red print. And it says, addiction and trauma symptoms are experienced and remembered as stories. So they're not just these light stories. They are how we remember, how we experience these events in this family's life. That stories are an integration, not just of the behavior, but of the behavior and how that behavior impacts the relationships within the family, the recursive responses of all family members. That I've seen families where siblings were mad at the parents rather than the sibling who had substance use disorder, because they felt that the parents didn't handle it very well. And I just use that example not to say it's true, but I use that example to say everyone's story is going to be different. And so at the bottom of that slide, each family member will have a different story of what happened and how it impacted them, and it will impact how they face the treatment process or the healing process. So it kind of looks like this in my mind. And so that if this big blue ball is all potential solutions to a problem, and let's say the problem is this person right here has a substance use disorder, that each person in the family, as they go through the various progressive symptoms associated with a growing, emerging substance use disorder, that they're going to experience it differently. And so that they may have very different views about what the solution should be and what do we need to try. And so I tried to write it as well as I could. But it says that when families have incompatible beliefs about what the problem is, who the problem is, and what solutions are required to solve it, that the family members have different ideas about what to do about it, that they may have really different memories when it comes to the healing process of what actually happened or what was said. And one of the things we find in families is that they often create new rules and roles as the evolving addiction progresses and becomes more severe, to where people may not be able to feel safe enough to talk about their views until they get into a program like a family program like ours, where they can begin to say, I'm just going to be honest about this. I'm going to tell you how I feel about it. And so, kind of long story short, that the human recall of what happened is not a reproduction of the event. It's a reconstruction of the event, not a reproduction. And by that it means my story is not a factual representation of what happened. It is as factual as I can make it. It is a retrospective report that captures meaning, my emotions, the impact on me, far more than it represents the micro behavioral truths. That it might be short on actual fact and very long on how that event impacted me. And that, it's not a bias as much as it's patterned. We've learned to do that. We have, over the course of the illness of addiction in our family, altered the way we see things, altered the way we react with it. So it is really important in this process. So are stories that we write the truth? Or are they the integration of different kinds of truth? And that's what I believe, that when I ask people to write stories, when I write questions to create stories in our modules in our program, I write them in ways that will help them not only, it's not like a police report where we're asking you to just state the facts, but the facts, how you felt, the impact of that event, and how it impacted the relationships within the family is really the story. And the creation of a story is based on 4 different kinds of truth: historical truth, emotional truth, relational truth, and then the narrative, how I describe it, all come together to form my story. And when we look at those 4 kinds of truth, historical truth is objectively what happened. And that I think the importance of what's different about an objective view and a subjective view is that, something did happen. Things were said. There is a sequence of what happened, but because of my emotional response to it, because of my fear and my the way my body reacts to stress and to threat, my objective or my subjective memory of what happened may be different than watching a videotape of what happened. And so the historical truth may be different for people who watch the same car accident. There's research on eyewitness testimony that says 4 people standing on 4 corners who watched the same automobile accident usually tell different stories about what happened. And so who's right, who's wrong is less important than how did what happened impact the other kinds of truth. Emotional truth, what it felt like when it happened. What was our emotional response? What did our nervous system do? Were we anxious? Were we numb? Were we, in fight or flight, trying to, argue and fight our way into, ending this situation? And then our relational truth. What happened to us in terms of being able to trust one another, being connected to one another, belonging to the system. I once talked to a mom who said that her son relapsed, and I asked how the discussion with the father went. She said things were said that can never be unsaid. That both people just escalated and escalated to the point of trying to defend themselves in a situation that did more harm than good. And that what we do is we take those, I think, subjective views of reality and what was said and kind of build our emotional truth and our relational truth into a narrative truth, into a storyline that organizes not only what we think happened, but who we are, our identity, and our future expectations, and what do we view for the future of our family. And so all of those are part of the truth. So I love this graphic because it really speaks to me of what I would like you to remember when I ask you, or when your therapist asks you to put some things on paper. And that is that our stories that we tell are the bridge between the facts of the event and the truth in terms of what it means to us. And that underneath that bridge are what we can remember and how we remember it, our emotions when it was happening and what we can remember feeling, our own history of prior trauma, transgenerational history, what we grew up with in terms of have we ever faced these kinds of arguments before? Did our parents argue like this? How did things get passed generationally? Our culture. And culture often sets our expectations about what's normal and what's not normal, what's healthy, what's not healthy. And so events happen and we filter them through all of these things, emotions and memories and history, and then we create what we say is the truth in terms of what it all means to us. That's what I'm really trying to get you to do when I ask you to write a story, to wrestle with putting those pieces together. And so what having a healthy story does is that the quote is, stories are the brain's primary tool for turning lived experience into predictability, identity, and action. That if we have a coherent story, and I can work with my family members to create a story that is more consistent across the board with understanding the differences, that's the beginning of family healing. And so that's why we have stories throughout our family program that people write, submit on our app. Other families in the program get to comment on it and give them feedback on it. They get a little discussion board to be able to hear others' responses. And then they can share it with their families, and it begins that healing process. What are some tools that you can use for writing your story? So the way that I would tell you to write a story. So what happens, and I said this a little bit earlier, the family members will say, I started answering the question and then it just got overwhelming to me. And I wasn't sure if it was accurate, if it was true, if it wasn't true, and then they erase that story. And I would say don't ever erase a story, but keep it, hold on to it, that it might be something that fits your story after you've gained some more insight. And so what I would say is that before you sit down to write the story, to do an assignment of on our app or whoever or whatever program you're working in, that you review the material that the story is being asked you to consider. And to read the assignment very closely. When I write those questions, I'm writing them knowing what material our family members are who have just reviewed, and it's asking them to write a story about their views of reality as well as their emotions and all the things we just talked about. Once you've reviewed those things, I do all of my free writing first thing in the morning. It's what I do when I get up in the morning, and then I grab a cup of coffee and I sit and I do everything I just said. And then after I've had that cup of coffee, I sit quietly for several minutes and try to block off, work and all the things that are kind of in my way, and think about what I've learned and think about the questions. And then I sit down and I write for about 20 minutes. And I don't try to worry about paragraphs and grammar and all that stuff. I just write for 20 minutes, write whatever's on my mind. And that's what I would tell you to do. Flight of ideas is fine. Just run on sentences is fine. But I want you to write your thoughts without editing, without filtering. Don't review what you've written. Just keep on writing. And it might be repetitive. There might be, this is an absolute first draft. Once your 20 minutes is up, take a break, get another cup of coffee, and give yourself another 10 minutes or so away from the story. And then go back and read what you wrote. Again, don't do a lot of editing. Read the story for the themes that it contains. What were you? What emotion comes out from the writing? A lot of times people will say things like, "I never realized how angry I was," or "I never realized how terrified I was." But boy, it came out as I was just allowing myself to write and to feel. Look at the topics. Who are you writing about? What are the things that came to your mind when you were doing that writing? Who was involved? What events did you think about or write about in that process? And so you're kind of reading your story and you're making kind of notes to yourself. And then identify what you're feeling in your body as you read the assignment. And that's your first draft of your story. And it may not necessarily be none of that may actually stay in the story as you kind of process it. But I would ask you not to think that you have to write your whole story in one sitting and being done with it. Some people can do that and do it beautifully. Others struggle. I'm not someone who can do that. I have to write it and go back and over it and over it. And so continue this process until you believe the story that you've written fits your experience of the event or the assignment that you've been given. And so if you're in our program, we're going to give you feedback on that story. And if there's some things we would want you to add or to think about, we're going to give those to you. So don't worry about that. We're going to help you with that process. But that idea of keep reading it, assessing it, not from you can run it through ChatGPT and get it to edit the grammar all you want. But at this point, it's really about what happened, how did I feel about it in my emotional state and in my body, how did it impact me and my relationships, those kinds of things. That's what I consider a healing story. So a couple things. I don't want to take up a lot more time with this, but the idea of as you're rereading and you're getting close to your final version, I want you to pay attention to how curious you are. And so for me, curiosity is the key to all of this. That idea that what does what I said mean? Like, it's not just the story, but what did it mean to me? And so there are certain kinds of words that people use, like trust is one. I just want to be loved is another. I want to be respected. I want to be able to respect my son again. I want to be able to trust my son again. And that people use those words and with this kind of belief that everybody knows what I'm talking about. Everyone has the same definition. And I'm telling you, that's not true. I was doing a therapy session with one of my students once, and it became really clear to me that they were talking about trust. They were all talking about trust. It sounded like this really great session. And that if they had not come to a point where they had to define what trust meant to them, they would have all left that session thinking, wow, that was really productive. And then realized that no one was going to change because they all had a different definition of what would be needed for trust or what trust would look like. And so I had them stop in the middle of the session, get out a piece of paper and pen and write their definition when they say trust. And what it showed was that there were 4 people in the room, and all 4 of them had different definitions and different expectations. So these are words like, this is a list of those kinds of words. Love and trust, respect, intimacy, loyalty, forgiveness, honesty. All of those are things that we assume everyone knows what that means. And I have sat what we call behind the mirror, which means sitting watching sessions of students at the university for, seems like 1,000 sessions. And a lot of times new therapists will ask a new client, so what brings you to therapy? And the client will say something like, I just want to be, able to trust my loved one had an affair, my loved one has an addiction issue, and I just want to be able to trust them more, And that student will often say, yeah, I know. And I'll think, wow, I've been doing this for 40 years and I don't know what that means. I know what trust means to me. And so I would say to that client, rather than yes, wow, this sounds really important. And I think it's a really important thing to work on in therapy. And I know what trust means to me, but I don't know what it means to you. Can you tell me what trust would look like? How would you know when you were able to do it? Things like that. And so as you read kind of the final versions of your stories, go in and look for words that you haven't fully fleshed out, that you haven't fully defined for yourself. And what would it mean? Or what would it look like if that were to happen? And there is a concept in narrative therapy and in solution-focused work. It's more solution-focused therapy, where we ask people what's called the miracle question. The miracle question asks that if something were to happen, that the problem that you're in therapy for is resolved tomorrow morning when everyone wakes up, what would be different? And so often people will say, well, they wouldn't be drinking. Well, yeah, of course, but what else? And that this idea of contraband words, that if you can begin to really look at, what would it look like? When I say recovery, what do I mean by recovery? When I say I'd like to get some closure to the loss of something, what does closure mean? When you say, well, I was triggered or I was overwhelmed, what does that look like? And what did that feel like? And I think your story becomes more real, the more honest and the more explicit you get in the words that you use in writing your stories. So all of these things are very important as we kind of move through the storytelling process, the story writing process. Again, it helps people be engaged. It helps people become more clear. It allows for catharsis and having emotional response. Please don't minimize the act of putting your life into a story or your experience into a story. And don't get defensive if someone you love has a slightly different or significantly different view of that. And so that's the story writing process to me. Hope it's helpful. Here's some information. If you're wanting to get a hold of me, there's phone numbers and content information. Visit my YouTube channel. I got all kinds of videos on there. I do have some podcasts, things like that as well. And if you're really interested in looking at my view of this, my book is called When the Solution Becomes the Problem, and helping families struggling with addiction and trauma. And you can go to my website and you can get it there. Okay, thanks.